It was the best of times, it was the worst of times. I think that if Charles Dickens composed this today, it would be as an introduction to the topic of global healthcare. The best because of really miraculous advances in medical science and technology. The worst because of increasing global health disparities and the seemingly out-of-control growth of chronic disease.
Current economic crisis isn't going away any day soon. The healthcare industry will be under great pressure to deliver value in ways it never imagined. Clinical boundaries are disappearing. The traditional doctor-patient relationship is undergoing deep changes. A physician in the ER today will do a portable ultrasound, run the patient through the CT scanner in the next room, and dispense medications from an automated dispensary. She'll provide a consultation to a patient from her car on the way home and pull the patient's new scan up on her handheld. That was unimaginable with the technology available only 10 years ago.
Across the world, emerging markets are creating their own models of healthcare. They're stepping forth with new ideas that we can learn from. Connectivity and mobility mean that these emerging markets can develop fast without the legacy constraints of the infrastructure found in the US or the EU. And all of this creates the potential for dynamic leaps in healthcare delivery systems and practice.
The do-it-yourself trend is moving into healthcare. Especially in light of the recession, consumers are looking for ways to take care of their health at home instead of at the doctor's office. This is the optimum time to talk about how taking care of health at home reduces overall healthcare costs. Not just through healthy lifestyles, but by talking about how chronic diseases can be monitored and treated at home. These days, patients are more aware and better educated than ever, and there's an up and a downside to that. The downside is that patients are often miseducated based on personal research on the internet, and healthcare providers find themselves needing more time to re-educate their patients when they have less time available to spend with their patients overall. The upside is a more informed patient, interested in taking an active role in their healthcare. PR is all about relationships, and this is especially true in healthcare. Strengthening connections with the traditional healthcare parties involved in key areas such as prevention, cost control, and home health will enforce a company's presence and value in this market.
A new level.
At the end of the day, it all comes back to being able to articulate what the physician and patient need in a home setting to manage health. The fact that Philips has been a leader in home innovation puts the company in a unique position to claim this space and to claim leadership.
In these chaotic times where we compete in a very cluttered communications environment, we must make bold, imaginative moves that truly capture the attention of the target audience. Philips can make a transformational move by becoming the enabler for healthcare innovation in emerging markets. Treat them as a work lab for medical innovation that truly evolves healthcare.
As the world starts looking for better answers to all of the questions around today's healthcare needs, there's a strong opportunity to establish a leader in healthcare. Right now, Philips is in the right place at the right time to make a real difference to global public health in the 21st century.